Hello everyone, today we will be studying about Schedule H and H1 drugs from the chapter Drugs and Cosmetics Act 1940, subject Pharmacy Law and Ethics, presented by KG Saraf, lecturer, KK Wagh College of Pharmacy, Nasik. So what are Schedule H drugs? This schedule contains a list of drugs that can be sold only against the prescription of a registered medical practitioner. Another provision needs to be followed is that only the required amount of medications mentioned in the prescription can be dispensed. These drugs can be supplied only to the licensed parties. Okay, so these Schedule H drugs are strictly to be given only if they are prescribed by a RMP, that is a registered medical practitioner, and the amount whatever is given on the prescription, only that much amount of drugs need to be dispensed. The drug label must exhibit the text RX and Schedule H drug warning to be sold by retails on the prescription of a registered medical practitioner only. Okay, so the drug label should contain RX as the label should contain RX as a text. Then it should be sold only, the warning should be given on the label in bold letters that it to be sold by retail on the prescription of a registered medical practitioner only. So this warning should be mentioned on it. As per the notification on 16 March 2006 released by the Department of Health under the Ministry of Health and Family Welfare, there are 536 Schedule H drugs. The original list contained 510 drugs, but this has been revised by the Drug Technically Advisory Board, that is DTAB, and the present list includes 551 drugs. So these are some of the examples of Schedule H drugs: abacavir, then albendazole, acyclovir, adenosine, alprazolam, amikacin sulfate, amiloride hydrochloride. Okay, so these are some of the examples under Schedule H drugs. Now, what are Schedule H1 drugs? For Schedule H1 drug, the warning given on the label is, it is dangerous to take this prescription except in accordance with the medical advice and not to be sold by retail without the prescription of a registered medical practitioner. So these two sentences are given on Schedule H1 drug label. The list of Schedule H1 drugs are alprazolam, cefpodoxime, then nitrazepam, codeine, diazepam, cefixime. So earlier all these drugs were under Schedule H drugs, but after the amendment, Schedule H1 drugs were separated, which included antibiotics and antitubercular agents and narcotic drugs, which were separated from the Schedule H and were included in the Schedule H1 drugs, so that more stringent or strict rules can be assigned for the Schedule H1 drugs. It is also compulsory to maintain a Schedule H1 drugs register in a pharmacy store and record all the transactions or when the drug was prescribed. Everything is to be recorded in that register, Schedule H1 drug register. So Schedule H1 is divided into three parts. It contains of antibiotics, tuberculosis, that is antitubercular drugs, and narcotic drugs. Okay. Then why was Schedule H1 introduced? As I told that Schedule H1 were mainly allocated to restrict the selling of antibiotics through over-the-counter sale. So many of the pharmacists or many of the pharmacy stores were giving antibiotics as OTC drugs. But it is to restrict this practice, to restrict this malpractice, Schedule H1 was introduced, that all these drugs are strictly to be given by a registered medical practitioner only, only under the prescription of a registered medical practitioner, and the record should be maintained. Okay, so the Schedule H1 drugs were given to restrict the sale of antibiotics through OTC. After it was noted that any number of these drugs could be bought from pharmacies across India without any limitations. So there were such practices going on in India. So, irrational prescribing of antibiotics and other drugs by doctors and chemists lacking a registered pharmacist has contributed to the increasing antibiotic resistance and tolerance of psychotropics. In response to these serious issues, antibiotic forums, scientific meetings, and symposiums were conducted by medical fraternity and various educational institutions. As a result, the Government of India issued a Gazette notification JSR 588E dated on 30th August 2013 regarding Schedule H1 drugs, which shows the importance of this schedule. So, Schedule H1 drugs includes third and fourth generation antibiotics, anti-tuberculosis drugs, and certain habit-forming drugs like psychotropic drugs. To dispense these drugs, two main criteria have to be followed. The drugs supplied under Schedule H1 should be recorded in a separate register at the time of supply, mentioning the name, address of the prescriber, name of patient, and name of drug along with quantity supplied. So, separate register is to be maintained, which should include all this information about that drug. The Schedule H1 should be labeled with the symbol RX in red, clearly displayed on the left top corner of the drug label, and it should bear the words in a box with red color border with Schedule H1 drug warning, like we have seen it earlier. These two sentences should be mentioned on the H1 drug label. It is dangerous to take this prescription except in accordance with the medical advice and not to be sold by retail without the prescription of a registered medical practitioner. So, Schedule H and Schedule H1 drugs are to be given only under the prescription of a registered medical practitioner, and Schedule H1 drugs are separated, which includes antibiotics, antitubercular, and some psychotropic drugs, which are strictly to be given under the advice of a medical practitioner, and the records should be maintained in the Schedule H1 register. So, this was about Schedule H and H1. Thank you so much.